Malaysia has made significant progress in providing its population with resources and treatment in mental health. Start from the mental hospitals, formal mental health treatments were eventually dispersed to general hospitals and primary care settings. Since the country doesn't have many resources, the focus is on helping people who want therapy in these settings. However, both internal and external health organizations must provide comprehensive mental health treatment that is coordinated to address the requirement of various groups of individuals with varying degrees of mental health needs. In order to make services more necessary and equitable, it is crucial to understand the population's demands for mental health care from the psychiatrist. A psychiatrist is a medical specialist focused on the diagnosis, treatment, and prevention of mental disorders, emotions, and behaviors in the patient. Psychiatrists are trained to evaluate both the mental and physical components of psychiatric issues. People seek psychiatric assistance for several reasons. Among them include panic attacks, terrifying hallucinations, suicidal thoughts, or they may be more persistent, such as feelings of despair, hopelessness, or anxiety that never seem to subside, or difficulties with functioning that cause daily life to seem twisted or out of control. However, is there enough workforce in this field to accommodate patients in this country? In general, Malaysia lacks specialists in the disease like this because awareness of the emphasis on mental illness is not widespread, and there is a lack of production of these specialist graduates in this field of health from the Ministry of Health and universities. In a 2001 WHO report, Malaysia had 0.3 psychiatrists per 100,000 per population. A more recent report in 2011, the ratios have been improved to 0.73. Now, in 2018, Malaysia currently has 410 registered psychiatrists with a ratio of 1.27 per 100,000 people, which is only 0.02% of the Malaysian population. The proportion of psychiatrists in Malaysia is higher than in other Southeast Asian countries, but still lower than in neighboring Singapore. However, the current number of psychiatrists in Malaysia seems inadequate to satisfy the demands of patients. It is very low, only 10% of the amount recommended by the WHO. As a result of rapid urbanization, there are fewer psychiatrists practicing in the rural regions, which adds to an already unequal distribution of doctors. Indeed, there should be one psychiatrist per 10% patients. However, the ratio in Malaysia is very low, at 0.1 in every 10,000. Malaysia requires at least 3,000 certified psychiatrists to achieve the WHO standard of 10 psychiatrists per 100,000 people to meet the minimum requirement for the country's population. Psychiatrists should be evenly distributed around the country. In Malaysia, 720 psychiatrists will be required by 2025 and 952 psychiatrists will be required by 2030. This requirement will be reassessed periodically depending on the demand for services. Overall, mental health human resource levels in Malaysia are relatively low as compared to those in other countries. This presents a significant challenge in developing mental health services across the country. However, it is difficult to predict what the field of psychiatry will look like in the future, and mental health professionals will need to keep up with developments in their field. Many missions performed by psychiatrists from today and the future in increasing the number of these experts to obtain targets in achieving their visions.
Hello, my name is Siti Nazirah. The issue that we got is the shortage and burnout among psychiatrists in Malaysia. An ever-increasing number of individuals all over the world are confronting the psychological well-being issues these days. This extreme lack of specialists in the nation might represent a few issues for the individuals who are confronting medical conditions. Remembering the delay for looking for treatment, looking for elective medicines which are not proof-based, long pausing time for mental consultation, inferior quality short-term psychological well-being care, joblessness, the rise of suicide case and vagrancy. The general professionals need to bear the weight of treating these patients and are probably not going to give the imperative norm of care, for example, psychotherapy. Current rehearsing psychiatrists may confront the high burnout rates because of the rising interest. The psychiatrist force is unevenly dispersed in many nations, with bigger and rich urban areas being generally taught with specialists. Thus, the countries which is poor might confront trouble getting into fundamental emotional wellness care because of the absence of assets. That is all, and I will pass to the next presenter. Thank you.
Hi, my name is Aisha and I will explain about the mental health conditions in Malaysia. Mental health issues that influence an individual's emotion, thoughts and behavior that referred as mental disorder, which also being called as invisible illnesses, had affected many people nowadays, especially in Malaysia, our country. These cover a wide spectrum of ailments such as anxiety, depression, bipolar and impulse control disorder. More than 80% people experience at least one diagnosable mental health illness, which really a serious matter, and 29% experience common symptoms such as anxiety, sadness, feeling of worthlessness, trouble concentrating, and having a hard time making decisions in their life. Also, 1 in 3 Malaysians struggle and battling with mental health issues, according to National Health and Mobility Survey, and only 20% of those who have a mental health disorder seeking help from professional assistance, which this may really affect the country well-being. Furthermore, on average, 29% of employees within firm have a poor mental health, which indicates 60 employees in the medium-sized company with 200 employees and 5 million ringgit Malaysia yearly gross output feel the sign of stress, anxiety, and sadness. The ensuing business expense, calculated as the sum of staff turnover, presenteeism, and absenteeism, is approximately 189,068 ringgit annually, which are 946 per employee, or 3.7% of the company's yearly gross output. Malaysia has a severe shortage of mental health providers, with 1 psychiatrist and 1 clinical psychologist for every 1,000 Malaysians, said WHO. A study conducted by Penang Institute 2017 said that there were only 15 clinical psychologists working in the public health sector across the country. If these issues of shortage and burnout of the psychiatrists being ignored, this will make our country having a lot of hard times in developing.
Hi, Assalamualaikum. My name is Nur Isika binti Nor Afendi. The next topic: thus, the number of psychiatrists in Malaysia is sufficient or not? We are aware of the lack of psychiatrists in Malaysia at the present time. Therefore, with just 15 clinical psychologists working in the public health service sector in 2018, the number of experts working in the field of mental health care is alarming low. The ratio of psychiatrists to patients in the populations is 1 psychiatrist for every 100,000 people. According to the Ministry of Health of Malaysia, the country requires an additional 261 psychiatrists by the year 2025 and additional 493 psychiatrists by the year 2030, according to the slide above me. The Ministry of Health has the goals of providing 1 psychiatrist for every 50,000 people in Malaysia by the year of 2025 and 1 psychiatrist for every 30,000 citizens throughout the country by the year 2030. This indicates that there would be a demand for a total of 720 psychiatrists by the year 2025 and 952 psychiatrists by the year 2030 to service the country's entire population of 36 million people. So, At this moment, Malaysia has a total of 459 psychiatrists, which is 1.5 times less than the objective for the year 2025 and twofold lower than the target for the year 2030. The next topic, does every state in Malaysia have enough psychiatrists? There were only a total of 410 psychiatrists working in Malaysia, which represents just 0.02% of the country's entire populations. The state of Wilayah Persekutuan Kuala Lumpur has the highest number of psychiatrists out of the 3 states in Malaysia, followed by Selangor and Perak. Only 1 psychiatrist can be found in the Wilayah Persekutuan of Labuan because there are only 1.27 psychiatrists for every 100,000 people in Malaysia in 2018. The ratio is very low. Wilayah Persekutuan Kuala Lumpur has the highest ratio, which is 5.24 per 100,000, followed by Wilayah Persekutuan Putrajaya, which is 3.38 per 100,000 people. The lowest ratio is found in Sabah and Kedah, where it is at 0.54 and 0.55, respectively, for every 100,000 people in each state. The number of psychiatrists in Malaysia is unevenly distributed, as both the table and the graph just we look at show us. Some states spend more than they ought to, while others don't spend nearly enough. It is essential that this be brought to the attention of the people in order for them to be able to obtain sufficient therapy from psychiatrists. Because our nation will soon be facing a mental health crisis that is much more severe than the one that we are experiencing. The government need to ensure that their already high figure remains unchanged in the future. That's all for me. I will pass to the next presenter. Thank you.
Thank you. Next, the recommendation for this issue. Firstly, the government need to make more medical schools to prepare more specialists, especially in the psychological field. By building more medical schools, the number of psychiatrists in Malaysia will also continue to increase. The government needs to open up space for more psychiatrists to contribute their energy and knowledge to the patient who have mental health issues in the country. Other than that, it is indeed necessary that the healthcare organisation, government and media assist spread the awareness among medical practitioners, employees as well as the general public about the critical demand in this sector. They need to know that every day more and more patients have mental health problems. So, their job is to create awareness for future graduates in the field of psychology to study hard to help all mental health patients after they graduated. Other suggestion is complies with other mental health experts. Psychiatrists should work closely with other mental health professionals, clinicians and educators, provide various forms of care for their patients and work to provide increased access and a higher standard of care for them. A senior psychiatrist doctor, for instance, may help a younger psychiatrist doctor treat a patient. If junior psychiatrists require assistance in treating patients, they should always learn from and consult with their seniors. Last, offer a high quality of rotation. Medical schools should offer more psychiatric rotation to their student physicians in order to entice more doctors to major in psychiatry. If students receive better clinical exposure to the real-world patients, practical psychological assistance and committed teachers to guide the learners, they will become more engaged in the subject and more interested in becoming potential psychiatrists. That is all from me. I will pass to the next presenter. Thank you so much.
In general, it can be said that the number of psychiatrists in Malaysia is not evenly spread around the country. There is a severe shortage of psychiatrists in the smaller states, whereas those in the larger urban states have greater access to mental health treatment. As suggested by the WHO World Health Organization, more work must be done to enhance mental health care in Malaysia, where there is currently only one psychiatrist for every 10 100,000 people. The government and the ministry must play a major role in addressing the density and distribution of psychiatrists in Malaysia to the ratio of 1 psychiatrist to 50,000 of Malaysians' populations. And these needs will be reviewed from time to time based on the needs for services. To achieve the targeted figures for the number of psychiatrists in Malaysia, the Health Ministry said it was continuously working to increase these figures, including by reappointing retired Malaysian psychiatrists on a contract basis to serve with the ministry on a need-based basis. Some other initiatives that can be implemented to increase the number of psychiatrists in Malaysia, which has been stated in the recommendation.